Today also the National Cabinet agreed some important measures, and Professor Murphy will go through those for you. The reopening of elective surgery. The boom is going up on elective surgery all around the country. That will be done, of course, at the pace that states set, but that will be welcome particularly to the private health industry in particular and the jobs that are supported throughout that sector. We also today adopted the National Mental Health and Wellbeing Pandemic Response Plan, put together by Christine Morgan, working closely together with the states and territories. And today we are committing $48.1 million in additional support for the implementation of that plan. And it was particularly encouraging to see that with the advent of telehealth, we are now seeing the number of presentations and consultations occurring for mental health now back to levels that were being experienced pre-pandemic. Half of those being done through the telehealth mechanism. So that is welcome. It's an important reminder to all Australians. Of course, keep COVID safe, but don't neglect your other health conditions. Human biosecurity emergency powers have also been extended under the Biosecurity Act. That was noted today, and that has been extended from June 17 to September 17. And a process has also been agreed for managing the access to affected remote communities under those powers in partnership with the states and territories and Indigenous community leaders in those communities. Yesterday, together with the Minister for Indigenous Australians, Ken Wyatt, I met with leaders of Indigenous communities, led of course by the Coalition of Peaks through Pat Turner, and we were able to speak directly to leaders of Indigenous communities around the country. And they have done an extraordinary job keeping their Indigenous communities safe through this crisis. There are two areas that National Cabinet was most concerned about at the start of this crisis, more than any. One was, of course, our elderly, and the fact that only 1% or thereabouts of the aged care facilities in this country have been affected by COVID is a tremendous credit to the aged care sector. But the other has been the low level of infection that has occurred in Indigenous communities around Australia. And to our Indigenous leaders in each and every one of those hundreds of communities, thank you for your leadership. Thank you for keeping your communities, our people together safe.